What is World segment tonight? According to a Gallup poll taken in 2011, 57% of Canadians are satisfied with their national health care program. The system is financed through tax revenues that can reach as high as 50% on income. And over the years, many Canadians have come here to the USA for things like surgery, because wait times are long north of the border. With all that in mind, Jesse Waters ventured out to talk with some Canadians.
Socialized Canadian healthcare. What exactly is that?
I think our healthcare situation right now is pretty ridiculous.
We pay a lot of tax, but we also get a lot for the tax that we pay.
What's the highest tax bracket here in Canada?
Probably 50%.
50?
Yeah.
Sounds confiscatory.
Coming from a homeless person who gets no access to any healthcare, I think it's a joke.
You're not crazy about it, are you?
What has your experience been like interacting with the Canadian healthcare system?
Excellent.
Obamacare is trying to emulate the socialized healthcare system here in Canada.
We have a socialized healthcare?
Use your brains a little bit.
What are you?
I'm on my way to being Tammy. I used to be Tom.
Yes, I'm making excellent progress.
And does the Canadian healthcare system pay for that?
Under certain circumstances, they will.
See, Obama tried to emulate you guys, and now it's a train wreck. So I think it's your fault.
Everybody blames Canada, right?
In this emergency department here, we have homeless people, we have bank presidents, they're side by side.
Have you heard of Obamacare?
Obamacare?
Yeah.
Is that a violent thing?
Sounds like a damn monster movie.
Are you satisfied with your healthcare here in Canada?
No, we don't enjoy waiting like months for an appointment, so it's not the most effective way.
What are you, a doctor or something?
We got problems today.
Did you have to wait in any line?
Yeah, about 8 hours.
Anywhere between 4 to 6 hours.
If the Canadian healthcare system is so good, why do 40,000 Canadians go to the United States each year to get treatment?
Because they're impatient and they got money.
If you need a special appointment, specialists take months to get, and then when people are ill, they don't have months.
I'm in the hospital, I take the things out of my arms and I run.
So you dine and ditch?
Yeah.
I was blowing off a little steam, so what? So what?
You're a holistic healer.
Yes.
How would you suggest I go about healing my ailments?
Yoga cures everything.
Awkward.
So when are you due?
It was due yesterday.
So this could happen at any moment.
That's right.
Okay. I'm not equipped to handle that.
What's the matter? You afraid?
What size cup are you now?
So those are natural after a year and a half?
Those are real breasts.
Yeah.
I like the way you're put together.
Do you think there's a doctor shortage here in Canada?
There's shortages in certain specialty areas.
You're not a socialist doctor, are you?
Well, I'm not sure if I use that word.
I was going pretty good there for a while.
Do you ever watch Bill O'Reilly on Fox News?
No, I don't watch TV.
How do you know what's going on?
I don't.
Do you ever watch the O'Reilly Factor on
I do.
Fox? You do?
I do. Bill O'Reilly. Wow.
Name the child Jesse. It's a great name.
Jesse, are you straight or gay?
I'm straight.
Don't think I don't appreciate the gesture.
That's all I want to know.
big tie for?
Real men wear pink.
So here's Waters. Why do 57%, according to the poll, like their health care system in Canada?
Well, it's free, for one thing. One guy spoke to...
When you say it's free, there are no co-pays, no deductibles, nothing. You have a card, you just walk in, they treat you, and you walk out.
A guy said he got free knee surgery. Only waited for about 4 months, but the knee surgery was free. A guy had AIDS that I spoke to for 20 years. He's been getting all the expensive medications, and he's been kept alive, so...
That's a good deal for them.
That is a great deal.
And now the guy that's going from Tom to Tammy, is that what it was?
Yes.
Okay. So he said part of it was being paid for.
Right.
Did you get to how much of it was being paid?
Well, he hasn't gone all the way, if you know what I mean. He has breasts,
okay.
Right.
But he's on the way. Are they picking up the whole tab?
They're picking up a large percentage. I think he said 75 or 80% of it
Because that's
is
obviously
picked up.
an elective thing.
Well, no, it's not. He is a man or woman trapped in a man's body, and that's very psychologically damaging.
We're not going to make fun of that.
I'm not making fun of it, but he says it's very disheartening, and he needs to live a normal life.
Certainly have their reasons for what they do, and that's legitimate.
Right.
But it's not a life-threatening, you got to get it fixed or you're going to die.
No.
It's this would make my life better.
Right.
So therefore, it's an optional surgery.
Right, so the taxpayers are picking up a part of that tab.
But not the whole thing.
Not the whole thing.
But if you have cancer or something, as you
Right.
said, AIDS, the whole boot.
But the problem with cancer, though, if you're diagnosed and you want the chemo right away, they'll put you in line for a few months. And a lot
you
of
have
people
to
don't
wait.
think it's acceptable to
Right.
wait for chemo.
And as you pointed out, a lot of thousands come here.
Right.
Yeah, if you've got cancer,
If
you
you
want
have
to treat
cash,
it right away.
you go to the United States.
So even with cancer, you got to wait.
You do.
All right, Jesse Waters, everybody. Plenty more.